cardiovascular and cerebrovascular events. It was shown that morning blood pressure predicts cardiovascular outcomes better than others. There's clear diurnal variation of the onset time of cardiovascular events. Cardiovascular events occur most frequently in the morning. Ambulatory monitoring has revealed that blood pressures tend to display a similar diurnal variation with morning blood pressure surge. In Ohasama study, morning and evening blood pressure predicted stroke risk equally well in general population, but morning blood pressure had higher predictive value in patients using antihypertensive medications. Average blood pressure during the first 2 hours after waking is an independent predictor of stroke risk. Patients with morning blood pressure surge were at the higher risk of stroke independently of the average 24-hour levels of blood pressure. In our study, morning blood pressure surge is related with cardiovascular. Our aim was to find if the morning blood pressure surge is related with cardiovascular and cerebrovascular diseases. We aimed to investigate the association of morning blood pressure with coronary artery disease severity in hypertensive patients. We included 187 hypertensive patients who underwent predictive coronary angiography. Patients with upper coronary syndrome and a history of coronary intervention were excluded. There is types of calculation of morning blood pressure surge. We use the sleep-through surge as the difference between the average blood pressure during the 2 hours after awakening and the lowest nighttime blood pressure. Severity of coronary lesions was evaluated based on syntax score assessed by coronary angiography. This is the diagram of the calculation of syntax score. You can find it on the internet. Patients were classified into 2 groups according to syntax score, low syntax score and intermediate to high syntax score. Syntax score is the calculation of coronary disease severity. Patients in intermediate to high syntax score group were older, have higher levels of uric acid, average daytime systolic blood pressure, average nighttime systolic blood pressure, average morning systolic blood pressure, morning blood pressure surge, have high rates of diabetes and female gender. There were no significant difference in terms of hypertensive treatment. In comparison of baseline demographics, age, gender, and diabetes were different between the 2 groups. And uric acid and for the laboratory findings, and average daytime blood pressure, average nighttime blood pressure, and average morning systolic blood pressure and morning surge for systolic blood pressure. In multivariate regression analysis, morning blood pressure surge and diabetes were independent parameters for predicting intermediate to high syntax score. The cutoff value of morning blood pressure surge obtained by raw curve analysis was 18.5 millimeter for prediction of intermediate to high syntax score. The area under the curve was 0.762. The raw curve. In scatter plot diagram, the R value was 0.30. Morning blood pressure surge significantly correlated with the severity of coronary stenosis in hypertensive patients. This finding suggests that it could be a potential